98.5 Speed FM.
Catch us if you can.
You get business, you get organization. Abi you want me to hear you for radio? Oh yeah now, make yourself join us so that we feel hear you for the speed of light. Make you meet your target audience and get to the reach where we say you self will deserve. Oh yeah, advertise on Top Asking Radio 98.5 Speed FM. Make you turn on also send message to 0809 927 5464 or 0816 609 2144. Asking Radio 98.5 Speed FM. Make you catch us if you fit.
Showing you wrong from right. I'll let you guide me. Just stay beside me. Oh, nobody wants to go it alone, and I just wanna stay here with you. You are a rainbow, so I am lucky. I am lucky. You are my favorite song. I am lucky. 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 Seasons change, but you're the same. Your love is constant. You've never lost it. Your voice is calling out my name. It makes me miss you, even when I'm with you. Oh, nobody wants to go it alone, and I just wanna stay here with you. You are a rainbow, so I am lucky. I am lucky. You are my favorite song. I am lucky. I am lucky. I am lucky. I am lucky.
Hello, welcome to Speed FM 98.5 Makudi. Welcome to the show Speedy Doctors. Today I'm Dr. Faeren Atsehe, popularly known as Dr. Fafa, and with me here is the guest speaker of today's show. She'll be introducing herself.
Okay, I'm Dr. Doofan Ayatse-Agishi.
Okay, welcome. A speedy welcome to all of our fans. Welcome to the Speed FM. So today we'll be answering your questions. You can send us your comments and questions on Facebook. We'll also be knowing when last you went for your medical check. And of course, if you are sick, we wish you a speedy recovery. So we'll be talking about cervical cancer today with my guest speaker. So cervical cancer, we already know it's a cancer that affects the lower genital tract of women, mostly especially the cervix of the women. We want to test your knowledge to know what you know about cervical cancer. So there are so many symptoms of cervical cancer. We have people having vaginal discharge, having lower abdominal pain, that's having frequency, urinating plenty times, having nocturia, that's urinating more at night, having stomach pain, that's lower abdominal pain. Some people have see blood during coitus, that's when they have sex with their partner, they are seeing blood during those periods. So what is the cause of cervical cancer? The commonest cause of cervical cancer is human papilloma virus, which mostly is the high risk type. High risk type in the sense that it's the aggressive one that can cause problems. So for medicine, the high risk types are the type 16 and 18, which can cause this cancer. While for the lower risks, we have the type 11 that can cause other problems, like the people coming with genital wax and some other problems that might not lead to the cancer directly. So we'll be asking Dr. Doofan, what are the possible risk factors that can give us this cervical cancer? So Dr. Doofan, over to you.
Okay, once again, thank you for having me. To answer the question directly, the common risk factors that are associated with cervical cancer. One, those who tend to have multiple sexual partners, have unprotected sexual intercourse, risky sexual behaviors, especially in sexual partners. We have also noted that those who tend to have sex at an early age due to increased exposure also tend to come down with this disease. I think by and large.
Yes, early marriage.
Yeah,
but of course, the early marriage now, we're not saying you shouldn't get married early, What we're trying to say is early marriage in the sense that you have like a continual contact with this virus, because if you are sexually active and you have a continual contact with the semen, and for example, you have a partner that has that, because some men are actually carriers of this virus, which is a human papilloma virus. So if you have constant contact with this man that has HPV, which is also that is a carrier of HPV, it's possible that it's there, and with time it can progress to cancer that will now affect us. So there are so many myths we've heard about cervical cancer. Dr. Doofan, do you know anyone? So many.
Yeah, there are so many, but most of them are usually around, especially things that have to do with vaccination.
Exactly.
And concerning cervical cancer, because we know that cervical cancer vaccines, that's the HPV vaccines, have actually been shown to be preventive in about 90% of women.
Wow.
Yeah. Very good statistics. So it's something that is being promoted nowadays, and there's a lot of awareness on vaccination. So most of these myths, especially around the vaccination, is that once you're vaccinated, you can go about having, further unprotected sexual intercourse.
And some of them believe that you can actually be infertile if you have the vaccine. You can actually be
infertile.
Which is false.
There are some people that even believe that when you have the vaccine, you also come down with cervical cancer, or rather it increases the risks. And these are all myths. So it means that they're actually false and they do not hold water.
Okay.
Yeah.
So what we're trying to say now is vaccination is very key and important. We're not saying vaccination prevents you from having the disease. We're trying to say vaccination helps to reduce the risks of having, let's say, a higher burden of that disease, right?
Yes.
So it's not like when you get vaccinated and you now get the disease, you now say, doctor, the speedy doctor, Dr. Fafa said it was not going to do this, and you now eventually did that. No, don't hold me to ransom, because I will not answer. I will not be answerable to that. I'm saying it will reduce the risks of you coming down with such things. So that's why we emphasize on vaccination. And of course, for cervical cancer, vaccination is open to both the girls and the boys. Yeah. The boys, because they are carriers, they can be carriers of this virus, and they can give our mothers, our daughters, and our children, right?
Yeah.
And the girls, because they have a cervix, which is what the virus targets, right? The man will not get infected because he doesn't have a cervix, but for the woman has a cervix, so the virus will go for the cervix and affect the cervix. So I think so far we can get vaccinations at primary healthcare centers in our town.
Primary health centers.
Yes.
All PHCs, primary healthcare centers in Benue State.
Good. So and for the age range, for the young children, we can go from 9 to 15 years, those that are not being sexually exposed, from 9 to 15. Then from the matured women, that's from, let's say, 35, or sexually active people, 35, 34, 25. You can go for your daily screening. And of course, about screening, I'll now come back to Dr. Doofan to tell us about the screening methods that are available for us for cervical cancer.
Okay, so maybe before I just go there, let me just track back a little to the vaccination. So the vaccination is for young girls, 9 to 14, and even young boys. Good. Because just like you have established, the men or the boys tend to be carriers of this virus. So in essence, they do not manifest the disease. Obviously, they do not have cervixes. but then they transmit these viruses to females and women, and then they are predisposed to coming down with cervical cancer.
Yeah.
So school girls 9 to 14, we're advocating vaccination, and usually they take about 2 doses 6 months apart. Then from those between 15 to 35, that's women, they will take about 3 doses. So once it's 15 to 35, the focus now is on women, no longer girls and boys. So the boys and the girls is from 9 to 14. So from 15 to 35, they will take about 3 doses. First dose at contact, second dose at least 1 to 2 months after the first dose, and then the third dose will now be 6 months thereafter. Okay, so now to the question of screening. How do we screen for cervical cancer? Essentially, your cervix actually has to be looked at, which is the part of the reproductive tract of the women, the canal in which, when a woman is giving birth, it comes into place. So the cervix. So usually there are several tests that can be done. One is the HPV DNA assays, which are actually very accurate and, also quite on the high side, but very accurate, yes. So we also have the pap smears, which are commonly done
in our environment.
In our environments, we take a specimen from the cervix. Actually involves a histopathologist. A trained doctor looks at the cervix and checks if there are any changes, early changes. So essentially, the aim of screening is to detect if there are any changes in the cervix that we can identify early and treat.
Good.
So HPV pap smear will come in there. We could also have visual inspection. Visual inspection using acetic acid, where we're also able to visualize. And if there are early changes in the cervix, some form of intermediary treatment like ablation can be done. And then we also have screening with Logos iodine, which is actually a bit low down there. And most times in resource poor settings when we cannot get the more accurate and preferred investigations.
Yeah, I think what Dr. Doofan is trying to say is forget all the English, the medical jargons, right? What we are trying to say is come to the hospital, get vaccinated, get screened. If you are sexually active, if you are a married person or you have a sexual partner, make sure you come for your screening. You can do it maybe 6 months time, you can do it yearly, however you choose to be or however active you are. I think that would help you to decide how often you come for that check, right? So that if there are any early signs for us to pick, we'll easily do that. Because this disease, it can be there for a long time and you don't do anything and it now becomes cancerous. So cervical cancer is actually a curable disease depending on how early it is detected, right, Dr. Doofan?
I agree with you 100%.
Yeah, so
curable and preventable.
Exactly. So don't wait for it to get bad and you now start coming at it at an hour we do not expect, or at an hour we cannot help you, right? So let's be more in tune with our medical checks and screening for all of this.
So maybe I should just add a little to that on the screening. So yes, we advocate screening, and for those who are listening, this is your window to know that once you're a woman, you should get screened often. And usually we advocate for those who screen and test negative. Of course, they are vaccinated, those within the vaccination age. But then you will still require regular screenings. If it's for those high sensitive tests like the HPV, the DNA, at least every 5 years. But for other methods of screening, every 3 years for a woman who is sexually active and within the ages of 25 to 65.
All right. So this is Speedy Doctors on Speed FM 98.5. Catch us if you can. And over to you. Let's get to know what you'll be asking us this week. We are live on Facebook, on YouTube, on all the social media platforms. So talk to us. You can call us on 080-8427-5464. 080-8427-5464. And if you call us, please just move away a bit from your radio so that we can hear you well. Don't be too close to your radio. We are live. You can call us on 8427-5464. Let's see. Macaulay, where are we? Speedy Doctors are here live. So let me just go to this question, Dr. Doofan. When last did you go for your medical checkup? Because that's the section we'll be talking about.
Okay. Yeah, I think I'm going to have to disappoint you because most people actually think that doctors don't go for checkup. But I actually did 2 months ago.
Yeah.
Did quite a bit of exhaustive investigations, checked my heart, checked my blood, assay.
Do you have any comments on? Okay.
Yeah, so I actually did
do
my checkup 2 months ago. Quite an extensive checkup. Especially with the burnout of doctors and all the stress.
It's crazy.
It's crazy.
You have to look out for ourselves.
Yes, you just need to ensure that things are in check.
Yeah. So I don't know what most people are quite in the hospital at the moment. I don't know. We are wishing you a speedy recovery. If you have sugar problems, hypertension, stroke, whatever it is, we wish you a speedy recovery, right?
Yeah.
Take care of yourself. And I think for me, the last time I did my medical checkup, I think you were quite earlier than me.
Okay.
I did it like 6 months ago.
I hope it was not mandatory
I did it 6 months ago. So, but I think very soon I will have to look at myself again because, we have to keep body and soul together.
Yeah, definitely.
To be sure everything
and
is
to
going
everybody
well.
out there listening to us, it's very important that you get your checks with the doctors.
Yeah.
Yeah.
So we are still waiting for call-ins. We are live. You can reach us on 080-8427-5464. If you don't want to reach us, you can type your comments in our Facebook chats, YouTube. You can reach us. They will answer your questions. Okay, so what more do we have to tell them about cervical cancer? We've actually briefed them about almost everything. I think we did not mention that cervical cancer is actually one of the second most commonest cancer in females, right?
Yeah.
After breast cancer. Yes, in Nigeria.
But globally, it's like the third.
Okay.
But in Nigeria, it's the second most commonest cancer.
Okay, it shows that it's very, very common. So we had lots of patients that we lost during this process.
Yeah.
And it came at a stage where we could not help them. They were just there. We could just, it was late. There's nothing we could do. It went into complications.
Yeah.
Some of them had kidney problems. They needed dialysis. They had respiratory issues.
Yeah.
Difficulty in breathing. So many things. It was crazy. And there was nothing we could do. We could just help them with supportive care till they'll get, okay. Yes, we have a call in. Okay, please. Okay, please, if you are trying to call us back, you can reach us on 080-8427-5464. Reach us. Reach your Speedy Doctors. Catch us if you can. We are here for you. For all your questions on cervical cancer, we are here for you. And ironically, next month is the World Cancer Day, right?
Yeah, 4th of February.
Exactly. So we're actually doing this at the right time.
Right time.
To create awareness and to let them know what is happening in the cancer world.
Yes, and still just to emphasize, because we're expecting a lot of questions.
Exactly.
That this cancer, when we talk about diseases that are preventable, the passion in me just builds up because it means there is something you can do about it.
Exactly.
So for cervical cancer, all it requires is screening.
Yeah.
Just get screened. And if you're not vaccinated, you get vaccinated. If there are lesions that we pick, we treat them. So that is the hope in this type of cancers. A lot of time people get scared. You hear people say things like, it's better not to know. No,
exactly.
that is actually a wrong.
I'm not sick.
I'm not sick. You don't have to wait till your system can no longer hold itself together. It's good to get screened. It's good to do your checkups. And for something like cervical cancer, which we are talking about today, it is highly preventable. I think one of the first questions you asked me, I emphasized that it has been shown that in 90% of women, it is preventable.
Yes.
And for we in most interesting is that the burden of this cervical cancer is actually in low-income countries like ours.
And it's a risk factor.
It's a risk factor because one, we are not even screening. So then why wouldn't our statistics be up? So it is said that even about 80% of the burden is actually seen in low and middle income countries. So and when there's something that can be done, this is an opportunity for our listeners out there to, get screened. If you have females, you have mothers, you have sisters, please encourage them to get screened. They can be screened in various health centers, and there are certain programs right now that we know within the states and certain bodies that are organizing screening for cervical cancers. So I believe we're here to take questions.
Yeah. Okay. So let's see how many questions do we have. Okay. I can see a question from Gifted, right? On Facebook. She's saying, how much does it cost to be screened? Dr. Doofan, can you answer that for us?
Okay,
how
How much? Now, the price depends on the screening technique, but usually roughly about 9 to 15,000 if you walk into a health facility. But currently, we know there's an ongoing outreach.
Okay.
Yeah, to mark World Cancer Day.
Okay.
There's an ongoing outreach to mark World Cancer Day, where some bodies are organizing cervical cancer screening. I think at the really, really subsidized cost of about 5,000 naira.
Okay.
So I think that that price is actually affordable. And this will be holding at Queen Rebecca
Specialist Hospital.
Queen Rebecca Specialist Hospital.
4th to 5th of
4th to
February.
5th. And they are doing this as their own efforts to mark World Cancer Day. So you can key into that if... you can key into that.
Yeah. So I think what I would say is, when it comes to health, people, I'm not trying to say like we have a lot of funds to spend per se, but when it comes to food, we spend money for food, right? When it comes for school fees, children's school fees, we always get money for that. It's very important. When we come to buy fuel for our cars, we do that. So when it comes to our health, I think we should use the kind of energy we use for those things to also do that to our health, because you need to have a functional system for you to be able to carry out all these activities. For you to go to work, you need to have a functional system for you to be able to go to work, to make the money, to take care of the kids, to take care of the family. So your health is an important aspect of your life that you should not ignore. So I'm saying this because we might ask how much it is. It's 5K because of this program that is ongoing, but maybe subsequently it might be more than that.
Yeah,
so you should be able to remove that money for your health. And after that, if you test and it's negative, you should be able to remove money for the vaccination. Because at the current time now, I think we have free vaccinations across the primary healthcare centers for young girls from 9 to 14 that are not sexually active. But I think for the older women, they might have to pay something for that. So we're trying to say, be intentional about your health. Spend money for your health, because you need to be healthy to carry out all the activities. You need to be healthy to make money. So please, going forward, let's try to spend more money for our health. So we're still waiting for your comments. We're live. You can call us on 080 8427 5464. Let me repeat that again. 080 8427 5464. So I'm waiting for your questions on Facebook, on YouTube, on our social media platforms, and you can call us live. So stay tuned. Okay. See.
Hello.
Yes. Welcome to the Speedy Doctors.
Yeah. Good afternoon, doctors in the studio.
Afternoon.
Good afternoon.
What's your name?
My name is Janet.
Okay, Janet. Good afternoon, Janet. Welcome to Speedy Doctors.
Yeah. How is your day going?
We're doing great. What about you?
Yeah, we're fine.
I'm good.
Great.
Yeah, I wanted to ask about the cancer screening.
Okay.
So, how much is it to do it, and how much about the vaccination when you are negative?
Okay.
And they have to vaccinate you about the screening. So, how much?
Okay, Dr. Doofan.
Okay, thank you for the question. So for the screening, across most health care facilities, we should be looking at between 9 to 15,000 in that range. But currently, we said there's World Cancer Day that is being celebrated globally. So we know of some bodies that are conducting the cervical cancer screening, and we said, and they are doing this on the 4th and the 5th at Queen Rebecca's Hospital, Ankpa Quarters, and we know that the cost is 5,000, and this is just subsidized for the cost of material. So maybe you can key into that. Now for the vaccines are following screening. The vaccines, and you are screened and asserted to be without any lesions that are suggestive of cervical cancer or any pre-lesions. That is lesions that will probably eventually
Lead to
progress. Yes, lead to cancer. You can receive vaccines. Vaccines are currently free at the
PHCs,
at the
primary health
PHCs or
centers.
every primary health center in Benue State. Yes,
for school children,
school
school girls.
Well, I think they said they could also extend it to ages 25. Yes.
I think the last time I did mine, I think it was like 18,000 per vial, and that was like 2023. So right now, 2026, of course, let's just say 20 to 25. I'm not sure, but we did that range. So just prepare for that. I think if you do at the first contact, the second dose, which is like in a month's time,
And
you
then
can
the third
gather
dose.
money. Yes, to do that. The third dose, you can also do that for yourself, because I bet you're treating cancer. It's not easy. It's better to squeeze
And
money.
it doesn't respect
Yes,
age,
it's better
class.
to squeeze money and get vaccinated than to treat the disease when you eventually have it, right? So thank you, Janet, for your call. Thank you so much. Hope we answered your question. So we are live. You can reach us on Facebook, YouTube, on all our social media platforms. You can also call us on 080-8427-5464, 080-8427-5464. Okay, I'm still waiting for any new comments, any questions. Okay. So Makodi, where are you? Speedy Doctors are in the studio. Where are you? Turn up live. Call us. We are here for you. Speedy Doctors are here. Make use of us. We are here. Talk to us.
Free services. Free
It's
services.
it's not when you come to the
Free
hospital and now
counseling.
say, doctor, this is what we can do for you, right? By giving the awareness, giving you the talk, the health education. So make use of us. Ask your questions.
Yeah, you know, I was going
Let's
to
correct them.
I was going to say that, you know, and this cervical cancer that we're raising awareness on today,
Yeah.
in fact, all cancers, they do not respect class.
Exactly.
They do not respect position. They do not respect, generally, they don't have any form of respect.
Exactly.
So that is why it's very important we screen, we get vaccinated.
Yes.
You spread the word out there to those close to you. Please get screened, get screened
And I
as much
think
as possible.
just like deviating a bit, I think it's the same to talk about breast cancer, like
yeah.
self-breast examination. You have
Self-breast
to do it.
examination.
Yeah. Prostate cancer, we say people should go for all this imaging tech that they will look at your prostate if
regular
there's any.
checks.
Yeah. So all of these things, because
Very important.
some things are actually incidental. You don't know that they're until you do a test or do something and you now discover that this thing is actually there.
It's actually
Because some
there.
things they don't even show you. By the time they're showing you those signs, they're already gone
far.
bad. Yeah.
And a lot of times when you screen and they are detected early,
Yes. You can now
it
start
can be
working on
treated.
them. Yeah.
The outcome, we will usually say in medicine, the prognosis, but to simplify, the outcome when they are detected early is actually fantastic for most of these cancers.
Yeah. And I feel the reason why like the cancers are quite let's say aggressive and quite bad for us is because we really have a poor health seeking behavior. Like
I completely agree.
exactly, because look at me
completely
now. I
agree.
said I went to the hospital for checkup like 6 months ago, but others do that like every time you get.
Yeah.
So because of that, people don't, and most people feel that if they're not sick, then there's nothing wrong with them. Why should they go to the hospital? Until when something hits them down, they'll now start looking for a hospital to attend to them.
Yeah, but on an average, even if you feel very fine, at least twice a year, 6 monthly. Yeah, if it's too tight, at least once a year. Do an exhaustive
Check-up, right?
Yes.
We know the country is hard. We know this sustainable regime is crazy, but
health is wealth.
Exactly.
Yeah, health is wealth.
Because you need to stay healthy to make the money, to make the peanuts we're making, right?
You need to be healthy to do everything. It starts with your health.
So we are live. You can reach us, call us, reach us on our social media platforms, on our WhatsApp, YouTube. You can also call us on 080-8427-5464. 080-8427-5464. We are here for you, so catch us if you can. Okay, so that's it on the Speedy Doctors today. We've been your doctors. I'm Dr. Faeren Atsehe, popularly known as Dr. Fafa, with
Dr. Doofan Ayatse-Agishi.
So keep your questions coming in on our Facebook, on our YouTube, on all our social media platforms. And that's it on Asking Radio 98.5 Speed FM Makurdi. Catch us if you can. Bye.
Bye. Thank you for having me.
Hello, Makurdi. Asking Radio is here.